Hello everyone, this is Dr. Shishma Sarala, consulting homeopath at Fidicus Homeopathy. Today we are going to discuss about something which is very important and as well as very frequently asked question in our clinic, which is, does PCOS cause hair fall? Yes, PCOS does cause hair fall. So today we are going to discuss about PCOS and its connection with the hair fall issue. So let's dive into the topic. So what is hair fall as such? There is normal shedding percentage in the hair, I mean on the scalp, as well as there is a percentage of hair which is growing also, and there is a percentage of hair which is constant. It doesn't grow, it doesn't shed, it's in that constant phase, and it does go to a shedding phase after some time, right? So what is hair fall? Hair fall is known as hair shedding or hair loss, refers to a natural process where the hair is detached from the scalp. Right, this is very natural. It happens every day in the humans, as well as you have to remember that out of the 100% in people who are eating highly nutritious food and good amount of exercise and sleep and proper work schedule, usually 60 to 65%, they will be having hair in growing stage, and then 15% to 20% in the constant phase, and other 20% in the shedding phase, right? So this is normal. It is normal to shed hair every day, right? But what happens is that if it is called hair fall when this shedding stage or this shedding percentage of hair is increasing more than the percentage of hair which is growing or which is constant, then that is called as hair fall or hair loss issue, right? If your hair is falling, that is the strands of your hair are more than 100 to 120, then you can call it as hair fall. Or if you are losing hair more than 100 or 120 per day, then that is called as hair fall, right? And then what are the causes of hair fall? Patients who come to our clinic, they have lot of questions about hair fall, like why is it happening? I'm eating good food, and like some people just tell like we are eating good food, we are working out, but still we have this hair fall issue. Some people just tell we have PCOS, that is why maybe we are having hair fall issue. See, hair fall has wide variety of causes concerned to it. Sometimes you might come in the category of 2 or 3 causes, sometimes just a single cause, right? So we will evaluate what are the causes of hair fall. The primary one, and this is something which should not be neglected, is the hereditary hair loss or hereditary hair fall. If your fathers, your forefathers, your mother or your grandmother are suffering from hair fall or have suffered from hair fall, you might have the probability of suffering from hair fall. But if you super add it with some amount of stress or lifestyle disorders, it can occur at a very early age, right? And then we have sudden weight loss. This is something which needs to be stressed a lot while explanation. Reason being that there are so many Instagram trends right now about nutrition, about what to eat, about the calorie amount of food. Some people just post that I've lost 10 kgs in a month. Some people post I've lost 5 to 8 kgs in a month. Some people just say in a week through the fat flush diet I've lost 7 kgs or 4 kgs of weight. Remember that according to guidelines, your body losing something so fast is not appropriate. You have to lose 2.52 to 2.53 kgs per month, which is very slow, yet it is sustainable on a longer run. Do not lose more than 3 kgs per month. Do not lose 4 or 5 kgs in a week. It has negative effects on your body. And after this weight loss, some people experience hair loss along with the weight loss, and some people experience hair fall or this hair loss symptoms after they have lost at least 8 or 9 kgs, right? If it is not done in a proper manner. So please try to lose weight in a simplified steps, consistent manner, working out as well as dieting, as well as changing lifestyle, doing some lifestyle modifications. Do not lose more than 3 kgs. It's not good for your body. Okay, right. And then people are losing a lot of weight and seeing this Instagram trends. That is not right. You have to understand that it is not right, and many people are doing it are not even doctors, right? And then we have hormonal changes. Even hormonal changes, high amount of certain hormones can cause E1 dominance, that is estrone dominance, can cause hair fall sometimes. PCOS can cause hair fall. PCODs sometimes with compared or with super added with nutritional deficiencies can cause hair fall, right? Hypothyroidism or hyperthyroidism, Hashimoto's thyroiditis, Graves disorder or Graves disease, autoimmune thyroiditis, all of this can have a negative impact on the hair, right? And also autoimmune diseases and even infections. This is something that I need to talk a little bit of. Remember that if you're someone who has suffered recently from dengue, from typhoid, from COVID like symptoms or COVID itself, see, remember that after viral infection or after bacterial infection, sometimes the body goes into a very weak stage after fighting the virus and after using a lot of antibiotics. So what happens is that normally the hair will start falling off after a disease, or after, it can be fever, it can be any sort of bacterial viral infection, which is very common. People are like, now I don't suffer with fever or pyrexia, now I don't have any other symptoms of what I used to suffer. But the hair fall can start during the fever, or it can start 2 to 3 months after your fever, right? So if you're someone who's suffering from post viral or post bacterial effects, you have to take care and see, do a blood picture and see what are the levels which have come down and come up, and take care of it, right? And then other causes are cancer treatments. Everybody knows that when you're taking chemotherapies, you do lose hair. And then medication, yes, that there are certain amount of medications which on a regular use, sometimes even hormonal contraceptives, can cause hair fall. And then stress is a major factor, lifestyle disorders are the major factor, the diet you're consuming is a major factor, if you're aging, that is also a major factor. All of this, especially stress these days, is a major cause behind lifestyle disorders as well as hair fall also. And then some people come to us saying, see, my mother used to have such long hair, I used to have very long thick coarse hair, even two handfuls used not to be enough for my hair. I used to have this big plate. I used to be a Rapunzel. That is what they used to say. Yes, you used to be a Rapunzel. But what I would say is, if there is stress, no, even though there is no any family background of hair fall, you will experience hair fall. That is also extreme kind of hair fall. So make sure that you maintain your stress level or decrease your stress level. By maintaining, I mean like uh, take measures as to decrease this stress level in your body. And then even scalp conditions, if you're suffering with scalp psoriasis, or if you're suffering with eczema, if you're suffering dandruff, any of the other things, make sure you take those into consideration and get treatment for that. Now here is a big question: how is PCOS causing hair fall, or how is it connected to hair fall? Let's review it in very simple terms so that it isn't complicated. And even if you're someone who's watching it and your friend or your family member is suffering from it, you can explain it to them, or you can just show this video so that they can have a proper idea why this is happening. You remember that PCOS, what does PCOS mean actually? PCOS is a trio of three things, which is the pi category. P for polycystic ovaries in the USG scan, I for irregular periods or irregular menstruation, and E for excess androgen levels, or excess or increased testosterone or DHEA levels in the body. Apart from that, PCOS also accounts for hyperinsulinemia, or we can also call it as, or it can develop insulin resistance, right? So these are the terms you have to underline, which is excess androgen and insulin resistance. So what happens is that usually whenever there is PCOS, there is excess androgen level, and this androgen level will act on the hair bulb. There is a bulb through which the hair grows, right? The hair root. Whenever there is increase in androgen level in the female body, what happens is that this hair bulb is being affected and it is being miniaturized. That means it will become small. So the hair will become brittle, it will become thin, and the diameter is very, very less. So what happens is that gradually the hair bulb is miniatured and then there is no hair at all. So you will be left with bald spots or baldness as such. So this is how PCOS maintains or causes this hair fall, because of the high androgen level. And the insulin resistance also will trigger hyperandrogenism, and that can also cause this effect in the body. So if you're someone who's suffering from either insulin resistance, or if you're someone who's suffering from hyperandrogenism, you have to understand that it causes miniaturizing of the hair follicle or the hair bulb as such, causing to hair fall or leading to hair fall. Now let us see what are the symptoms of hair fall. So first and foremost, you would be experiencing thinning and shedding of hair, which is thinning of hair as that is the diameter decreasing, and shedding means falling of hair. Then receding hairline, either on the sides or in the front. And then you will have scalp visibility, where the scalp is like where the hair is shedding off too much and the scalp is visible. And then you have brittle and frizzy hair. The scalp is very oily, it can have dandruff as well. And there is pattern hair loss, which is, you have to remember, if you're someone who's suffering from PCOS, and if you're someone who's suffering from a different kind of a disease and both are having hair fall, you can distinguish the hair fall of PCOS. How? Because PCOS shows male pattern baldness in females, whereas other causes shows female pattern baldness in females. So if female is suffering from male pattern baldness, then that can be because of PCOS or hyperandrogenism. And then you will have distress having all of these symptoms, which is common in female. And then distress because of all of these symptoms. Now, what does conventional form of treatment or allopathic form of treatment has to offer for PCOS hair fall? We are not discussing about hair fall of other causes. Here we are discussing about hair fall which is caused only due to PCOS. First, they would give to treat the PCOS, they have to give you oral contraceptives which have their own side effects, which is having weight gain, oiliness of the skin, acne, hair fall issue, mid-menstrual bleeding if you're stopping it, if you're stopping the pills. And remember, if you're someone who's suffering from PCOS and hair fall, you have to visit a gynecologist for PCOS, you have to visit a dermatologist for your acne prone skin, you have to visit a trichologist for your hair fall, you have to visit a nutritionist for good nutrition advice, and then you have to visit a yoga instructor or a gym instructor to maintain your health. You have to visit 5 or 6 people as such for this PCOS and hair fall. That is one drawback. And the second drawback is having side effects of allopathic medications. And third one is anti-androgen medicines, because there is excess androgen. We are giving anti-androgen medicines, so that should be it, right? But no, because if you stop anti-androgen medicines, what will happen? You will have a recurrence of the symptoms and hair will again start to fall, right? That is another side effect, or we can say negative of this allopathic form of treatment. And other part is using metformin, which is for insulin resistance or for type 2 diabetes that you develop. And then minoxidil, as soon as you start using minoxidil, you might be getting small hair which are thin and brittle. But if you stop using minoxidil, which is 2% or 5%, it can again reoccur. Your hair fall can again reoccur. Why does it reoccur? Is because you're not treating the cause here. What is the cause here? The cause here is hyperandrogenism. The anti-androgens will only block their effect, but they will not do anything which is triggering this hyperandrogenism. So you need a system of medication where you don't have to visit this number of doctors. You have to just visit that doctor and a nutritionist and a gym instructor for your better lifestyle. So, and also it doesn't have a lot of side effects, and also it should not have any recurrences, which is nothing but homeopathic form of treatment. Here we understand the link. Even if 2 or 3 people who are in the same family are suffering with the same disease, the same amount of medication or the same type of medication will not be prescribed to all the family members. Each family member is different from one another. In homeopathy, we try to understand that. We try to understand the familial link. We try to understand your stress. We try to understand your job and how you are responding to it, how your body is responding to it, what is the response and what is the stress signal. All of this will be studied holistically, where we'll give you a constitutional medicine which will suit all your needs. And then what will happen is, by taking homeopathic medications, your abnormal cravings will come down, your menses will get regularized, your hormonal levels will get regularized, and then there is no mid-menstrual bleeding in between. And then your all your cravings will come down, your mood fluctuations will come down. In a timely fashion, it will cure your case. It will help in relieving your symptoms, curing your case, and preventing further recurrence. If you're someone who's suffering from PCOS or hair fall or any other female reproductive organ diseases, Fidicus Homeopathy is the answer. Here we have 2 kind of consultation options. The one is online consultation, and the second one is in-person or offline consultation. If you're someone who's staying by the nearest branch of Fidicus, so you can come and contact us or come in person and take doctor consultation. But if you're someone who's staying far away from us, you can take an online consultation. You can take either audio consultation or a video consultation. After an audio and video consultation, after investigations have been verified, especially to online clients, medicines will be door delivered to you. If you're staying in India, it can take 3 to 4 business days, USA 3 to 5 business days, across the globe anywhere 4 to 8 business days for our medicines to reach your doorstep. If you want to get in touch with us or contact us, you can call us on this number, WhatsApp us, or messages. And if you would like to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. Here we have discussed how homeopathy, is the best choice of medicine for lifestyle disorders as well as female reproductive organ diseases. Here we will be discussing how Fidicus Homeopathy is the best choice in homeopathy. Fidicus Homeopathy stands for highest chance of health. Here we do follow 3 strict principles. One is we are already experiencing good amount of success, that is high success rates in PCOS, PCOD, bulky uterus, adenomyosis, endometriosis, fibroids. So the success rate is really good. Apart from that, even Bartholin's cases, the success rate is really nice. And here we have transparent treatment. There is no gray area between the patient and the doctor. Everything will be clearly explained to you. The prognosis will be clearly explained to you. And the personal care here at Fidicus Homeopathy is top notch. Any sort of queries that you have or any sort of doubts that you are expressing will be cleared. If you want to choose cure, if you want to choose health, choose Fidicus Homeopathy. Thank you.